Good evening, ladies and gentlemen. Welcome to yet another show of Health Booth exclusively on your Christian TV station, the Heaven Bound TV station. And if it is Wednesday, you know it is time for this educative, wholesome, and good show about your health. And today we are going to tackle on a very important topic on stroke. My name is John Kimura, and today on set, I'm privileged to have the presence of our able doctor who is going to share with us everything about stroke, and we hope that you're going to have a good time. So stick on this station, stick on this show, and be sure to engage us through our social media platforms, through our email, through our number that is running on your screen. And God bless you so much. So to start with our show, Dr. I'd like us to start with the very definition of what stroke is. Yes.
Good evening once again, viewers. I wish also to welcome you to the show as we discuss this topic, stroke. It is a common phenomenon in the society. It is a troubling thing that affects many people, and especially those that are aging and who have some other conditions, as we shall see during the program, that predispose them to stroke. So by definition, I'll begin by saying that stroke is a neurological impairment where the brain is affected by a disruption in the blood supply to the brain. Okay. Where there is a disruption in blood supply to the brain, a stroke results. And this disruption may result because the blood supply to the brain is blocked either by a blood clot, or it is because the blood supply to the brain is impaired because the the vein that was supplying that particular part of the brain has ruptured, and therefore a stroke results when there is a disruption in blood supply to a particular part of the brain.
Okay. That so in other words, it's a condition that is as a result of a certain situation.
Exactly. It is a condition resulting from impaired blood supply to the brain. And you know the brain coordinates all parts of the body. Okay. So, and this brain needs blood supply, yes, so that it receives oxygen, yes, and other nutritional requirements for it to function. Okay. So if there's a disruption in the blood supply to a particular part of the brain, then stroke will result.
Is it a disease? Can you say it's a disease?
It is not a disease, as if you may understand definition of a disease, stroke is a condition, a resultant of a certain physiological impairment of blood supply to the brain.
Okay, and Dr. You have mentioned about this situation of a stroke resulting from a rupture. Can you explain to us what a brown rupture exactly means in this situation?
Okay. This term brown rupture is actually just to depict the color of blood as it supplies the brain. Okay? Okay. That is why the word brown rupture is coiled from. However, there is another way that we could define this brown rupture, whereby there is something that we call a formation there is a condition whereby there is formation or a collection of like a protein coverings or coatings onto a blood vessel. Okay. So as this collection of proteins continues along the way, at one point, or a clot forming within a blood vessel, when this clot ruptures, again it may travel from one point, which is not necessarily within the brain itself, but it can be traveling from another point where it ruptured from, and then as it travels, it occludes or it obstructs blood supply to a particular point of the brain, and this is how it causes the impairment of blood supply to that particular part of the brain, resulting into this stroke.
Okay. Is there any other maybe source of stroke apart from what you're talking about, maybe the rupture and maybe the cut off of blood supply to the blood?
Yes, there is, to the brain. And perhaps when we shall be looking at the causes of stroke, we may come to discover that there are several types of stroke. Particularly two types, yes, generally two two classifications,
Yes.
but there are several other subclasses of stroke.
Okay.
And in the process, we shall come to learn
Okay.
that the cause it may not necessarily be because of a ruptured blood vessel, but even trauma to the brain can cause blood supply to the brain to the brain to be impaired, and therefore result into a stroke.
Okay. And maybe I'm sure even our viewers, they're listening and watching us. I'm sure this is the question that most of them might be asking themselves. Who are these kind of people? What category of people are most vulnerable to stroke?
Okay. We have the risk factors to stroke. Who is more vulnerable to stroke? Every other person is vulnerable to stroke because they can suffer maybe a traffic accident and have their brain injured, and therefore every other person is predisposed to stroke. However, we have some risk factors that have been highlighted as the major causes of stroke, or the factors that predispose one to stroke, and they could be categorized, John, into several classes. This classification could be into classes like those that are unavoidable, those that you have no control over, such like aging. For example, when one ages, the blood vessels tend to harden. They tend to harden because of aging processes that are natural. They are given. So as one ages, they are predisposed to having stroke. Because as the blood vessel hardens, then it means that it loses its elasticity, and as it loses its elasticity, it allows minimal blood supply to a part of the brain, and therefore this person, as one ages, specifically aging from 65 years and above, one is predisposed to stroke because of the aging processes that harden the blood vessels. However, again, John, there are those people who are said that are more prone to stroke as men. Men are more, in terms of sex, men are more prone to stroke, but because of the improving healthcare systems and the improvement in aging and provision of healthcare as people age, we have life expectancy increasing. As life expectancy increases, more women are said to stay longer than men. I don't know why, John, but more women are staying longer. And as they stay longer, if you took the statistics at a particular age, say 70, you would find more women having stroke as compared to taking the same statistics at an earlier age where you would have found more men. So aging is a factor, and sex is a factor. The rest, again, they are saying that compared to whites, the blacks are more prone to stroke. Again, this is natural, God-given. We can't have an explanation for that, but ethnicity or the race of one's is also a factor that predisposes one to stroke. Again, family history. We have people who have issues with their family where high blood pressure is a factor in their family. It runs in a family. And therefore, people with high blood pressure, again, are people who are predisposed to stroke, and therefore, if you have a family history where people suffer from high blood pressure, you are a likely candidate of having high blood pressure. And high blood pressure, John, is a factor that can lead to stroke. So several factors are modified. Some are non-modifiable. Non-modifiable means that you cannot control your age, you cannot control your sex, you cannot control the family you're coming from, you cannot control your race. Those are non-modifiable factors. We also have factors that are modifiable, John. Factors that are modifiable are things that one can work on. And these factors, if you work on them in proper time, you again limit the possibilities of getting stroke. Factors such as hypertension. Hypertension is a common phenomenon in our society these days, John. And therefore, if one is hypertensive, if you do not take good control of your hypertension, you are likely to suffer stroke, because this high blood pressure is going to put pressure onto the blood vessels. And remember, John, the blood vessels in the brain are tiny, are minute, are tiny because they have to allow a lot of blood exchange between the brain and the blood supply. So if one is hypertensive and the pressure is so much onto these tiny blood vessels, again, one is at risk of having stroke. So control on hypertension is a factor that one can work on, is a modifiable factor. Another modifiable factor, John, is Smoking. Smoking is said to have an effect, or again, on blood vessels, where it hardens the blood vessels. And as you shall be looking at maybe at the types of stroke, you shall find that there are those strokes that result because there is not enough supply. As much as there's nothing obstructing the blood supply, the blood is not getting enough, and the brain is not getting enough supply. And this type we shall be referring to, we shall give it a name as we go on. And therefore, this type of smoking that hardens the blood vessels causes this person to have a risk to getting stroke. Again, another person who has diabetes, if one is diabetic, again, diabetes and the high blood sugars have an effect on the blood vessels. This one person, again, who has diabetes can have a risk of getting what? Stroke. Obesity is a modifiable factor. If you are not working on your weight, again, you risk having your heart work so hard, you develop high blood pressure, and high blood pressure predisposes you to stroke. Another thing, John, is where one has heart issues. If you have a heart problem that is affecting the way your heart is functioning, again, it may not be functioning well enough to produce to supply enough blood up to the brain, and therefore you risk getting a stroke. And therefore, again, another thing is about lifestyle. Some people like really a distance that you can walk, you board a vehicle. Sedentary lifestyle, John, is a risk factor to one getting stroke, and therefore people need to do exercises daily or occasionally. It is said that at least 2.5 hours in a week, within 7 days, at least commit 2.5 hours for you to do some exercise that you burn the excess calories or the excess fats. We like red meat so much, John. We like nyama choma. And this nyama choma has some kind of fats that are not so good for our health. It increases, these fats again occlude the blood vessels, and this occlusion leads to impaired blood supply to the brain, and therefore one risks getting a stroke. So there are several factors that one can work on. We can do away with nyama choma, not entirely, because I know you and I like it. But but again, there's a way that we can use use it in moderation. So working on such like modifiable factors would help us get away or reduce the instances of one getting stroke. Those are just but some of the factors that predispose people to stroke.
So from what you're talking about, Doctor, is like most of those factors are lifestyle. They're how people
exactly
how their normal life. And maybe from where you see it, what's the statistics of people getting stroke in our society?
In our society, as I said earlier, well, having been in a hospital setup or working in a hospital setup, I want to say that the statistics indicate that it is so high in our society. But because maybe you do not know somebody who has suffered from a stroke, you wouldn't say that there are many people suffering from stroke. But actually, every other person who has high blood pressure has a risk of getting stroke, and therefore the statistics are so high, especially among our male members of the society, because again I said that the aging of men is the life expectancy of men is lower as compared to that of women, and therefore statistically you may find that more men are suffering from stroke because of the risk factors of life generally. They are the ones who do the nyama choma, they are the ones who do alcohol, they are the ones who do tobacco or smoking, and therefore they are at a higher risk of getting hypertension. Again, some men, sorry to say, but they are a little bit reserved when it comes to health matters, and again they wouldn't want to be limited. They wouldn't want to be to sound so limited when you tell them please reduce the amount of nyama choma you are taking, and therefore again when you tell them that it is not good to do alcohol or smoking, some of them are a little bit resistant, and therefore they increase the statistics in our society of those people who are at risk and actually who suffer from stroke.
Now, is stroke a death sentence or it's manageable?
Perhaps as we shall be looking at the complications that result from stroke. I wouldn't want to call death as a complication. Death is terminal, is an eventuality, is the end term. But actually, stroke is not a death sentence. There is a remedy to stroke because it is manageable. But before we talk of managing stroke, the members of our society need to know how to identify one who is suffering from stroke, because the earlier the intervention, the better the results. The better the result. If it is intervened in good time, that is when we can avoid some of the complications that result. But permanent disability, there are many cases that result into the many cases of stroke that suffer permanent disabilities. Yeah, so it may not lead actually to death as it were, but actually permanent disabilities are there, and therefore early identification of a stroke is important so that intervention can be done.
Okay, and moving on, do we have maybe some parts of the body that are at a higher risk to be when attacked by stroke? Yes.
Yes, there are those parts of the body that are affected majorly by stroke, and these parts, viewers, maybe you may need to know that if a blood vessel ruptured on my right side of the head, of the brain, then my left side of the body will show the symptoms. Actually, it will be the one that will be affected. This brain, the way it functions is that the left side controls the right side of the body, and the right side controls the left side of the body. So if I suffered a stroke or a ruptured vessel on my left side, my right side will be affected. And this will be seen whereby my hand, or generally paralysis, I'll suffer sort of a paralysis on my opposite side. It is called the contralateral side of the body. If I suffered a stroke on the left, the contralateral is my right, and therefore the right side will suffer paralysis, or it will be impaired in function. Again, speech, sight are some of the things that are affected by a stroke.
Oh, yeah, that's wonderful. And maybe that even might be something, maybe even before we wind up the first part of the show. Most of the time, the people that you hear they have stroke, most of the time it is the left side, sorry, the right side that is affected. Okay. Because maybe you might explain to us, maybe it's because if it's the left side that is affected, which has the heart, eventually they could have died.
Okay.
Yeah. Why?
Okay. Stroke is a cardiovascular issue. Cardiovascular means that it is affecting the circulation of the body, circulation of blood in the body, and the heart, of course. The left side of the heart is responsible for pumping blood to the whole parts of the body. So if the left side of the body of the heart is again affected, any part of the body could be affected with this impairment on the left side of the heart. So again, just to remind our viewers that a stroke can suffer any part of the brain. What happens is, if I suffered a stroke on the left side, my right side will be affected. If I suffered on the right, my left side will be affected. So any part of the body can be affected by a stroke, irrespective of whether it is the left side of the heart affected or the right side of the heart affected. Because so long as there is impairment in blood supply to the brain, any part of the body will be affected with this.
All right. Thank you so much, Dr. Obviously, there's a lot we can discuss about stroke. So I'll encourage you to, if you have any question, just put it through our SMS number, just going through your screen, or even through our email on WhatsApp and what have you. So we're coming to the end of the first part of this show, and when we come back, we're going to tackle more of the symptoms and the signs of stroke, so that you may have the knowledge on this kind of a condition. So see you after a moment. Welcome back, our viewers, to our second part of this show, The Health Booth. And I would like us to start this segment by asking our doctor, are there some different types of stroke, or just stroke is just a one thing in general?
Okay. There are several types of stroke.
Okay.
But as I alluded to in my introduction, I say that there are two major classifications of stroke.
Okay.
And these two classifications refer to one as ischemic stroke and another one as hemorrhagic stroke.
Okay.
Ischemic stroke is that kind of stroke whereby, because of one reason or another, a part of the brain is not receiving blood supply. The blood supply to a particular part of the brain is cut off because of maybe a clot, or there's this thing we call plague. Plague is an accumulation of proteins in a blood vessel. So as time goes by, this accumulation narrows the blood vessel so that this blood vessel is not able to carry blood to that particular part of the brain that is affected. This is what we call ischemia. Ischemia means impaired or cut off blood supply. Ischemia. So a part that is suffering ischemia, be it the brain, be it any part of the body that suffers ischemia, it means blood supply to that particular part is impaired or disrupted, completely cut off. Okay, that is ischemia. So ischemic stroke results when, because of maybe of the narrowing, because of the hardening, a condition that we call atherosclerosis. Atherosclerosis is where the blood vessels do harden because of the fats that accumulate and the proteins that accumulate in it, and therefore this accumulation makes the blood vessel not to be able to carry blood past where the accumulation is or where the obstruction is. So a clot can cause ischemia. A blood clot can cause ischemia. A hardened blood vessel can cause ischemia because it's not able to function properly and carry blood to whatever part of the brain that it's supposed to carry. So when we talk of ischemic stroke, it means blood supply to a particular part of the brain has been impaired or disrupted. Another type of stroke, I said there are two. The other type is hemorrhagic stroke. Hemorrhagic stroke is where a blood vessel supplying the brain is ruptured and therefore a bleeding occurs. Okay? As this bleeding occurs, it causes some pressure on the brain tissue. This pressure prevents or obstructs or causes dysfunction of that particular part of the brain where it is pressurizing. Right. Okay, so this pressure resulting from a blood vessel being ruptured and bleeding causes the pressure, and the pressure causes what we call hemorrhagic stroke. There is another type, and these two, ischemic and hemorrhagic stroke, have their subtypes, which may not be necessary for now for us to tackle. But we need just to understand that ischemic stroke is where blood supply is impaired because of one reason or another, either a clot or something that is obstructing the blood vessel from supplying blood, and another one is the hemorrhagic, where there is bleeding in the brain, maybe because of trauma. One has suffered trauma maybe during an accident, and therefore they bleed, and this blood that is being bled causes pressure on the brain tissue, and therefore it results into a stroke. There is another mini stroke, they call it a mini stroke, but it is called transient ischemic attack. A transient, or TIA is a transient ischemic attack, is where for a moment a particular part of the brain does not get enough blood supply. Maybe because this clot is not completely obstructing blood supply. Okay. Or because of the pressure that comes with the blood, it has moved. And therefore, for a moment, this person suffered this mini stroke. It causes symptoms more or less like a normal stroke. Okay. But again, it is for a moment. It lasts from minutes to hours. Within 24 hours, this TIA should have cleared. The symptoms that a patient was suffering should be able to clear within 24 hours. If it goes beyond 24 hours, then it's not a mini stroke anymore. It is an ischemic stroke. We have to treat it as ischemic stroke. So I would say there are two major types, but this mini stroke is an additional type, and one who suffers a mini stroke is likely to suffer a major stroke. It is an indicator. A mini stroke as an indicator is an indicator that at one point this person might suffer a major stroke. And therefore it needs to be treated with the seriousness that the other types of stroke actually are being treated with. Yes.
Wonderful. So as you're talking about, there's a question that's coming to my mind, and it's about the bleeding. Can the bleeding be, is it only into the brain, or it can be so serious that might be, the blood might even be coming out through your eyes, ears, all that?
John, blood that is coming out is better than blood that is being retained. Why? Because blood that is coming out will not cause any pressure onto the brain tissue. But blood that is accumulating within the skull, within the brain containment, then that is the blood that will cause pressure onto the brain tissue, and this is the blood that will cause stroke, a severe stroke. If it were bleeding outside, it wouldn't cause this pressure, and therefore I'm not saying that when one bleeds outside they are better placed. No, blood should be where it is supposed to be. It should be within the body, it should be within the vessels. But however, if one suffered maybe trauma or is injured onto the on the head, and they have to bleed, if they bled outside, they wouldn't suffer easily a stroke as compared to one who is bleeding internally within the cranium, because again, increased intracranial pressure has its own complications, because there is a particular pressure within which the brain operates. So when there is any bleeding or any additional material within the skull, then it causes increased intracranial pressure, and one of them is the result of one of them is stroke. So besides other impacts of bleeding within the intracranial pressure.
That's wonderful. So maybe now, maybe if we can get the differentiate between now a stroke and a heart attack.
Maybe at one point we shall have to talk about heart attack. But for now, the difference is simple. Stroke affects blood supply to the brain. Heart attack, we talk of a heart attack when blood supply to the heart is the issue. When there is an impaired blood supply to the heart. You know, the heart, as much as it pumps blood to all parts of the body, it also pumps to itself. And if a heart does not have blood supply, one suffers a heart attack. And this heart attack can be so detrimental that it can result into stroke, besides affecting all other parts. I would rather one suffers a blood supply cut of another part of the body than the heart. The heart is selfish, and it reacts violently when it is denied of its own blood supply. So heart attack affects blood supply to the heart, but stroke affects blood supply to the brain.
Wonderful. Thank you for the distinction. So I'd like us now to discuss what are these signs and symptoms that one would exhibit as an indication of having a stroke.
Now, signs and symptoms of stroke, and please viewers, you need to be keen, because identification of these signs and symptoms will result into early diagnosis and early intervention and better results. So we need to recognize that one is likely suffering from a stroke, or is he an impending stroke or a TIA, and therefore we need to take a medical intervention for us to have good results from stroke. So suddenly one suffers numbness or weakness of the face or leg, and this especially affects one side of the body. Okay? Suddenly one will complain that I'm feeling numbness on my one side of the body. Okay? The face on that side is numb. Okay? The hand on that side is numb. The leg on that side is numb, and generally one is feeling like they are losing function of that side of the brain, of the body that is affected. Okay. A reminder, if one suffers on the right side, numbness on the right side of the body, it means they suffered a stroke on the left side of the brain. Okay?
Yes.
Now, another thing, confusion sets in. One becomes confused. They are unable to speak or understand issues. Why? The brain coordinates speech.
Exactly.
The brain coordinates understanding. The brain coordinates our general memory. You see, if you are confused, it means that you are not aware of what is happening around you.
Yes.
That is because the brain is not functioning as it's supposed to be. And why is it not functioning that way? Because it's not getting enough blood supply. Why? Because of the stroke. Okay? So confusion and sudden numbness is an issue to be recognized when one is suffering a stroke or an impending stroke. Again, one is suffers trouble walking. Of course, if you are having numbness, it means that you can't walk properly. It means that, again, you are dizzy, you can't balance or coordinate your movements properly, because that part of the brain that is supposed to coordinate movement is impaired because of impaired blood supply to that part of the body, of the brain. So again, we have those symptoms that are in both types of stroke, the hemorrhagic and ischemic stroke. One suffers, one is more severe. Okay. And again, one is likely to suffer more severe symptoms when they suffer from hemorrhagic stroke. Hemorrhagic stroke, where there's bleeding into the brain and the pressure is there, then the symptoms are more severe, but the symptoms are more or less the same. They are more or less the same, except that they are severe in hemorrhagic stroke as compared to ischemic stroke. Again, one may complain of neck pains, and again, they may complain of headache. And a severe headache, John, besides being a sign or that affects people who have high blood pressure, again, when there is a severe headache, it means there's increased intracranial pressure, maybe because there is bleeding in the cranial cavity because of a stroke. So severe headache is also another indicator of a stroke. Now, we have those signs that are common in women and those that are common in men. However, generally those three that I've talked of are apply across. But in women, it is said that some may suffer from nausea and feel like vomiting. Okay? Some may suffer from hallucination. Hallucination is whereby one creates something that is not there. You may say that I'm hearing a voice. You know, there is a stimulus that is not a real stimulus. You may hear a smell that is not there. Suddenly one feels like there is a perfume smelling somewhere, or food being cooked somewhere, and yet there is no such like a thing. That is a hallucination, where you are responding to a stimulus or perceiving a stimulus that is not existent. That is a hallucination, and this affects women mostly. Again, pain is another symptom where one, because of nervous in neurological impairment, one suffers from pain or pain that is unnecessary. You see, you are trying to use a limb that is painful, or you are losing function of a particular part of your body, and then you are suffering this pain because it is abnormally senses. The sensory part of the brain is affected, and therefore you are feeling pain that is not really there, that is not be felt again. Okay, so some suffer from seizures or convulsions, if we may call them, and some also suffer from shortness of the breath, where you have difficulty in breathing. Again, remember, the brain coordinates some of the major functionings of the body, including breathing. So if you have a difficulty in breathing, if that part of the brain that controls breathing, for example, is affected, then you'll have difficulty in breathing. So these are some of the things that affect stroke in women. But in men, those three, there are three things that you need to remember in men.
Okay.
One, drooping on one side of the face, where one side of the face, if you ask this person to smile or to show you their teeth, the mouth will not open evenly.
Okay.
The teeth will appear on one side of the body, but the paralyzed side, the mouth will not open.
It's closed.
It's closed. Okay?
Okay.
That is what we call facial drooping. Okay? Slurred speech. Slurred speech. Okay? Where communication, they can't communicate properly. They can't talk properly. If you ask them to say a word after you, the common word is that you ask them to say, you cannot teach an old dog new tricks. This person will not be able to say that. They won't repeat this. Can you try that, John? You cannot.
The saying.
You cannot teach an old dog new tricks. Repeat that.
You cannot teach an old dog new tricks.
Correct. Yes. You are not suffering from stroke. Okay. Now, so those are some of the things that you need to note in a person who is suffering from stroke.
Yes.
Again, the arm weakness, the arm drift. One will be suffering from an arm drift. This arm drift, I don't know if John, if I could have demonstrated, but an arm drift. If I asked you, John, to hold your hands, both of your hands, like this, ahead of you, like that, on the same level, suspend them in the air, on the same level. Okay? Yeah. Suspend them. Okay. If I asked you to close your eyes for 10 seconds, 10 seconds,
position of my head.
just facing the forward, okay? Yeah. Close your eyes for 10 seconds. A person suffering from a stroke, after 10 seconds, the side that is affected, this hand will be lower than this other one after 10 seconds. Okay? They'll be able to maintain the unaffected side. They'll be able to maintain the position of the arm on the unaffected side.
Okay.
But the affected side, that hand will drop in 10 seconds. Okay? So those three signs are there for those people, especially in men who suffer from a stroke. Okay. It is important, John, to note these signs and symptoms, because the earlier the intervention, the better the results.
Exactly. So, are there serious consequences of a stroke?
Yes, John. Yes, there are. There are serious consequences, and perhaps we can look at them in details when we come back, where we can see the effects of a stroke. And I said death is not one of the consequences, because we want to talk about a person who is still alive.
Okay. That's true. That's wonderful. And maybe just to give us some maybe assurance or maybe some hope towards the ones that have their brain damaged as a result of stroke. Is it able to repair itself naturally?
Again, nervous tissue, including the brain tissue, the nerves, the nervous tissue, including the brain tissue, is one part of tissues of the body that do not regenerate. They do not regenerate. So it is hard we want to fully recover from a brain damage and a nervous repair. It is hard. When one has suffered from a stroke, and seriously, if it was not intervened in good time, the damages in most cases are permanent, because brain tissue does not regenerate. Does not regenerate.
That's a serious one.
Very serious.
Okay, our viewers, that marks the end of our second part, and just stay tuned, and we'll be back after a very short moment. See you. Thank you very much, our dear viewers, as you continue to watching us here at Heavenbound Television and on this health show, The Health Booth. We are continuing to discuss about stroke, and we have seen the causes, we have seen the symptoms, the signs, and at this part, the third and the last part, I'd like us to look at some of the management measures towards stroke, some of the complications that are there in stroke, and some of the prevention measures that we can apply in avoiding stroke. And I'd like our Dr. to start with what are some of the management measures towards stroke.
Okay. Viewers, the management of stroke depends on the type of stroke. Okay, so once one has been diagnosed to have a stroke, the management course will depend on the kind of stroke that they are suffering from. However, remember, viewers, that I said that there is this kind of stroke that we call a transient ischemic attack, a mini stroke. This mini stroke may probably happen when you are with the patient at home or the victim at home. So as an emergency, what you can do is to recognize, first thing is to recognize that this person is suffering from a stroke. However mild it may look like, it is a stroke. And therefore, as an emergency measure, what you can do is to get this person a drug as simple as aspirin. Getting aspirin will help a lot in preventing the detrimental effects of a stroke when it is exacerbated. However, now when one has gotten to the hospital, after you have given this aspirin, you are not managing stroke and leaving this victim at home. Okay? You take them now to the hospital. In advanced circumstances or in advanced healthcare systems, we have specific numbers that deal with stroke, specific hospitals that are stroke oriented, and one would call such like. But in our setup, it is to go to the nearest hospital that you can get healthcare support or care. And therefore, when you get to the hospital or when the patient gets to the hospital, the doctor would want to take a history from this victim. And perhaps because they are impaired in their speech, you who has brought the victim will be the one to give the history. They would want to know, has this happened before? They would want to know, does the patient suffer from hypertension? Did they have a previous history of hypertension? They want to know, has any member of the family suffered from a similar experience? Those are the kinds of history that you need to arm yourself with as you take this patient to the hospital. Then the doctor will do a physical examination. This physical examination includes taking their blood pressure to ascertain whether they have a high blood pressure. High blood pressure is a very high risk factor for stroke. Okay? Then again, they will conduct blood tests. They will take a sample from this victim and take to the laboratory, where they would want to know, is this person being a diabetic patient where the blood sugar is high, or have they been suffering from high blood sugar? Again, they would want to know if this person, from the blood test, they would want to know the clotting time of one's blood, because again, one could be having issues with their clotting factors or the clotting time, and therefore these are some of the tests that will be taken from the blood. The major distinguishing test that will be done in the hospital is a CT scan of the brain. This CT scan of the brain will give us a guideline whether it is an ischemic stroke or a hemorrhagic stroke, because the management depends on the kind of stroke that one is suffering from. Okay? Now again, the doctor may want to do what we call an ECG to assess the performance of the heart. An ECG measures the electrical activity of the heart. So if it has an issue, again, this will show us that the heart is the problem. It is not pumping enough to the brain, and therefore correcting the issues with the blood will solve the issue with the stroke. So the management again will follow depending on the results that are gotten there. So if it is an ischemic stroke, again, we need to do away with this thing that is obstructing blood supply. If it is a clot, we need to digest this clot. There are drugs that will be given that will digest the stroke. Again, If it is narrowing of a blood vessel, there is surgery that can be done to put what is called a stent or a balloon. Or a stent is like a mesh that now balloons the heart, the blood vessel. Okay, it is inserted into the heart and it remains. It's left into the blood vessel, and it lets the blood vessel remain open so that blood can flow. It is a stent. Okay, again, surgically the clot can be removed. Okay, surgically the clot can be removed. Mechanically removing the clot from the blood vessel. Okay, that calls for craniotomy. Craniotomy is opening up of the skull to access that blood clot and remove it.
Okay.
It sounds amazing, but just imagine if one had a big blood clot, maybe from trauma, the blood clotted in the brain. What do you do? You have to remove this clot. Yes. It may take some time for a drug to digest a big clot, okay? Yes. So you need to remove this blood clot mechanically. And let blood continue flowing, okay? Yes. Yeah. So surgical intervention is an necessary. Okay. If it is hemorrhagic stroke, if one was suffering from hypertension, that is the one that caused the rupture of the blood vessel, then again, antihypertensives. One is to have their blood pressure put under check by taking antihypertensive drugs. Okay? Another thing is we have this thing we call aneurysm. Aneurysm, I'll demonstrate aneurysm later. But when there is a ballooning of a blood vessel, okay, a particular part of the blood vessel balloons. When it is ballooning, it is likely to rupture. Okay, so this ballooning needs to be put under check. Okay, and this check is called clamping. So again, to avoid the rupture or the bleeding, then we need to do clamping of such like a blood vessel. Again, there are some other surgical procedures that can be done to correct hemorrhage. Okay, and therefore the management of stroke takes those two dimensions depending on the type of stroke. Okay,
that has occurred.
Yeah.
Oh, and what are some of the complications that may occur?
The major complication that occurs is due to a result of brain damage. Now that the particular part of the brain suffered from blood impaired blood supply, the brain cells are damaged. Now the effects of this damage are what one experiences. Some of them are long term, some of them with early intervention can be corrected. Okay, so paralysis is one of the complications that results because the brain has been damaged, and therefore the brain does two major things: the motor function and the sensory function. Motor function is what enables us to do activities with our body. Okay, like this hand I'm moving is a motor function, and it is coordinated by the brain, enabled by the brain and the nerves that supply this particular part of my hand. So motor function is impaired because the cells that are supposed to coordinate this function have been damaged by a stroke. So again, paralysis is another issue that results from the memory loss, is another permanent thing that one can suffer. Emotional problems. Remember, we talked of people being confused, and therefore emotionally they will be wondering, and their close relatives and the people they interact with will be wondering again what is happening with so and so, because they have been normal and now they are seeming confused. So emotionally they will be suffering. Pain is another issue, and change in behavior of such like people because of the stroke. Eventually, John, we talked of death, and it is true, stroke can lead to death because, again, I said the brain coordinates major functions of the body, including breathing. So if the part that is supposed to be controlling and coordinating and enabling breathing is affected, then again, because of a stroke, then this function is impaired and death can result. Okay, so a stroke is that severe, and it needs to be well managed. Early diagnosed, well managed.
The better. better it is. So with all that we have discussed about the effects, the management, the complications that come hand in hand with an occurrence of a stroke, are there any preventive measures that we should put in place?
Exactly. There are some preventive measures that we can put in place. But before we tackle the preventive measures, in summary, I would want to say that when one has suffered from a stroke, they need to undergo therapy.
Okay.
Some of the therapies that they need to undergo, maybe now the clot has been removed, but that part of the brain has been affected, and there's no regeneration. So if they were not able to speak, they need to undergo speech therapy. Okay? If they were not able, they were confused, then they need to be brought back to reality through what we call cognitive therapy. Again, if they were not able to, if some part of their senses, parts of their body could not feel senses, could not be feels lost sensitivity or sensory, then again they need to relearn how to do such like things. And again, physiotherapy is another thing that one needs to undergo, because if you suffered paralysis, perhaps the blood, the nerve did not die completely. So with continued physiotherapy, you can regain some of the functioning of that particular part of the body. So to the preventive measures.
Yes.
Preventive measures, actually, if you are a smoker, you need to quit smoking. Okay? Preventive measures. Okay? Now, if you are an alcohol, you need to quit drinking alcohol. Again, I know we are talking to people who, some are in the church, some are not yet in the church, but God loves you. If you are not yet in the church, you need to come to church. Actually, we are campaigning for stopping drinking. So you need to stop drinking. I wouldn't say that you consume in moderation. No, stop it. Okay? Again, we talked of weight being an issue. You need to eat food that is just nutritive enough for your body. Don't overeat to control your weight. Avoid saturated fats. These fats that you find that at room temperature, it is solid. You see? This fat that is solid at room temperature needs to be avoided, because similar solidification takes place in our blood vessels. Okay? And this is what occludes our blood supply to the brain, okay? And can lead to stroke. So again, these fats are also found in the nyama choma we talked of, John. Okay? reduce nyama choma. If you are suffering from a condition, maybe you are diabetic, maybe you are hypertensive, maybe you are you have these conditions that predispose you to hardening of blood vessels. You need to put them under check by visiting a doctor, doing a regular medical checkup. I know we Africans and maybe Kenyans, we don't just visit a doctor for the sake of it. We don't. And again, when some of the doctors, again, they have issues. When you walk to the hospital and say, daktari nimekuja checkup, kuuliza checkup ya wapi? You see? So again, a regular checkup for just knowing the health status of your body is also good, because it will help us diagnose some of these hypertensions and blood sugars early enough to avoid stroke. Okay. So stroke is avoidable. Okay. It is avoidable. In summary.
Yes, in summary. There's something you wanted us to show us from the board.
In summary.
Yes.
In summary, viewers, we have been talking about stroke.
Okay.
We talked about stroke, and we said that stroke is a neurologic an impairment that results from impaired blood supply to the brain. Okay? This impaired blood supply to the brain may result because there is a blockage. Now we are talking about the types. Okay?
Yes.
The types. Where we have ischemic stroke, and hemorrhagic stroke. Okay? Ischemic stroke is because blood supply has been cut off. cut off. Hemorrhagic stroke is because a blood vessel has ruptured. Okay? And because of this rupturing, blood is leaking, and it's leaking into the cranial cavity. Cranial cavity. As it leaks into the cranial cavity, it causes increased intracranial pressure. This increased intracranial pressure will result into the effects that we see from a person who's suffering from stroke. Okay, we talked of the signs and symptoms. And the signs and symptoms, I said it is good for us to notice them early enough.
Yes.
Early enough, because the earlier the intervention, the better the outcome. Okay, so 3 things that you need to look for. 1 is fascial drift. Okay? Fascial drift. Where you ask somebody to smile, and one part of the face, of the mouth does not smile evenly.
Smiling halfway.
Okay? Halfway smile. John, you have correctly described it.
Yeah.
Halfway smile.
Smile.
Okay?
Yes.
Speech impairment. Okay?
Yeah.
Where you ask somebody that you cannot teach an old dog new tricks, and this person is not able to repeat the same.
The same thing.
Okay? And arm drift.
Arm drift.
You ask this person to put their arms forward, and the part that is affected drops. The unaffected part remains at the level you placed it after 10 seconds. Okay? 10 seconds. So it is important for us to recognize these things and take intervention as early as enough. I said intervention includes what do you do immediately? Recognize the signs.
Okay.
The signs. 2, buy aspirin. Aspirin. Take the patient to hospital. Okay? After you have done that, prevention. Work on your weight. Okay? Control underlying conditions. Treat, for example, hypertension and diabetes. Okay? Another thing you need to work on, if you are alcoholic, stop alcohol and smoking. We look forward to seeing a stroke-free society.
There you have it from our very own doctor, tackling the issue of stroke the best way that he could. So thank you so much for joining us along this show, The Health Booth. I know that it has helped you a lot, especially with all the questions that maybe you had in your mind. And if you have any other question that was not tackled, feel free to text. Use the number that is on your screen, and somebody will get back to you. Even our doctor will get back to you and answer all your questions. So God bless you. Stay tuned to this beloved TV station, the Heaven Bound TV station. And let's meet next Wednesday, same time, same place. My name is John Kimura. See you and good night.